Hello, Raj. Could you please unmute yourself?
শুনতে পাচ্ছো?
এখন শুনতে পাচ্ছি। Good to see you.
Good to see you.
কেমন আছো?
ভালো। তোমরা?
Amita, for inviting me for this discussion panel. And coming to your question that what this virus does. So basically, coronavirus is a family. And under this virus, there are a lot of species. Some species of coronavirus only affects human, and they are called human coronavirus. And they cause basically common cold that we are all familiar with. There are other species which affects animals like bats, cats, camels, etc. But sometimes these animal coronavirus, they go some genetic change in nature, which is a complicated process, but finally they jump into human. And when they jump into human, then the problem starts because it human-to-human transmission occurs and then causing this kind of pandemic. So COVID-19 is basically an example of that. Here, the disease is called COVID-19 and the virus is called coronavirus SARS-2 because there was similar virus happened in 2003, 2002, 2003. So how this thing happens? Any infection to happen, you need basically a source first. So what is the source here? Source here is basically a human, either a case or the carrier. Case means they have the disease and carrier means they have the virus, but they don't have the disease. And then what happens, how it comes to another human? Basically, there are three main modes. One is droplet, one is contact, and then airborne transmission. That is also another component that we are thinking about. Now, how the process happens? When a patient coughs or sneezes or even normal conversation, they create a lot of particles and they are full of viruses. The larger particle, they are called droplet. And if you're close to within 6 feet, that's why we are talking about all 6 feet. You're close within that 6 feet, it falls on you. And if the particles are very small and the lighter particle, they do not fall. They just remains in the air for some times. And they say that virus can be alive in that suspended mode in about 3 hours. So you can inhale that virus. Or contact, meaning the patients are coughing, but they are really not covering the cough and they are touching some surfaces. And then you come and you touch the surface, you touch your face, nose, and you consider the whole face, including eyes as a unit. And the main mode, main portal of entry is, the name suggests, it's an respiratory virus. So basically it's your respiratory tract. So what happens? The virus enters into your body. And if you imagine your respiratory system is like just an inverted tree. Your trachea is your main stem, and then it branches and branches. And then where you see the leaves and flowers, basically in our lung, that's the space. It is air-filled pockets, sacs, like we call it alveoli. And that's the main area where the main thing happens, that is gas exchange. We need oxygen and to survive, and we release carbon dioxide. That thing happens in that level. So that is very important. So when the virus enters, they go into the cell, and everything is a complicated process, but to understand simply, they enter into your cell and they multiply. And basically a human body turns into a battlefield. So your virus is multiplying and they are kind of a micro soldiers. And our body, we have immune system. It's very sophisticated system with different cells and with different function. So the fight is basically a fight goes on between this microorganism and your body system. And it's a simple rule. If your system is good and strong, you win, you clear up the virus. And that's all happens in majority of the patients of COVID-19. 80% of the cases during that period, it's a battle. So they will have fever, some flu-like symptom, but your system is good, so you clear it. But 15% of the patients, they deteriorate and then they develop pneumonia. Then your lung is affected. That time your patient will be a little sicker. They may have high fever, chills, and then they have shortness of breath also. And you may not be able to take care of yourself at home that time. You need upper level of care, because that time you need supportive system. So when you go to the hospital, then they give you supportive care, and at the same time, your immunity, that's a key point. So you, again, there is battle going on, and then you are getting extra support, so you get better. But about 5% patients among those, they are the critical, that we say the critical patients. That means that time your body is fighting at the maximum level, and all the sophisticated immune cells, they come into play. And it is a process, it's a complex mechanism, but the bottom line is they release a lot of chemicals, they talk to each other, and each chemical has some particular function. And what happens at the alveolar level, the gas exchange does not happen anymore. These whole sacs are no more filled with air, it is filled with fluid. And then what you need is basically you need some help to breathe, and who can help that time is basically a ventilator. That's all. That time the patient goes on ventilator, they are seriously ill. And what's the outcome? Outcome is sometimes really this COVID-19 does not have any standardized care like the way we have for influenza. So basically we try, when patient comes to the hospital, we give the maximum supportive care. And again, your body is fighting at the maximum level, but the outcome is not very good. Sometimes patient come back, very few people, sometimes do not. So that's the bottom line of your infection, how it happens. You can imagine our body as a house with a strong wall. If you have a strong wall, strong window, if the storm comes, there will be some shaking. Maybe your, hanging, wall hanging will be here and there, but you will, when the storm goes, your house will be fine, you'll be fine. Exactly the same way. Your immune system good, you're fine. Your immune system is bad, you don't do that well. So that's all I have to say about this COVID infection, how it happens. Coming to your second question that you told me, what's a challenging part of this virus? I will say the virus, the character of the virus is challenging, really. It's highly infectious. The disease COVID, it's a high mortality as compared to your influenza. We really do not have any specific treatment that for influenza we have. We do not have vaccine that we can give it to the patients. And also we are seeing that even if patients are exposed to the infection, developing antibody, but this antibody may not be protective antibody. So that leaves us in a really bad situation, unprotected basically. And only thing we have is basically preventive care. So that's all I have to say about why this virus is challenging.
In fact, thank you for sharing this, the most simplified way. I know that it is a very complex thing, but here we probably don't know what is RNA, what is DNA, and how these things work. But right, the way you explained, that helps people. Yeah. Now, my second question is to Dr. Chaudhary, Dr. Tapan Chaudhary. You are a primary care physician for many of us, of our community people, and there are also several guidelines available from different specialized healthcare places. But still, could you please explain some most simple way? What are the guidelines? What should we do? What should we do? What we should not do? And please unmute your computer. Yeah, you are fine now.
Can you hear me? Okay. First, good evening, and thank you very much, Amitabh. I think you're doing a tremendous job, especially in this time where we are all confined at our home. For us to get together, all friends, it's great. There is one interesting thing about COVID is that none of us know too much about it. And the so-called specialists do not know that much about it either. You are discovering something new, and it's going to be months before we are going to know more. So our answers are always incomplete, all right? So let's, can I share it with you, the thing I have here? Okay, now let's see. Can it be seen properly?
No, we don't see.
Not yet.
We
Share screen.
we can see your screen. You need to click the share screen
In the middle.
Where is it?
in the middle of the if you see the bottom part, there is a green sign with an arrow. Share screen.
There is no green sign.
Kapunda, are you on an iPad or a computer?
Computer.
I'm on a, I'm on a laptop.
Yeah, go to the bottom of the Zoom window. You will find a green little window with an arrow, black arrow up.
But right
Click
now, right now the slide is covering everything.
Okay, so
Well-
you can minimize that first.
Also is enlarged.
Yeah, first minimize that
Okay,
slide,
there you are.
and then you will see share screen. You see chat and then share screen, green sign.
Right at the bottom.
Share screen. There you go.
There you go.
If you click, then you will, okay. Yeah, now we can see. And you can do it, maximize it, or yeah, elaborate it, expand it.
Yeah, green one. Yeah, exactly.
Can you see it now?
Yeah,
Very good.
Yes.
Okay. Let's start here. This is a product of my son and daughter. My daughter Pakhi has been clamoring for face masking long before it became the national policy. And she based it on the fact that in South Korea, in Taiwan, in New Zealand, Australia, that appeared to work very well. So she had a lot of information and gave it to Raja, who is, he converted it into a graphic, which is interestingly, there is a guy in WHO who liked it very much. So I don't know what is happening with it, but it is pretty illustrative. So we all of us know that there are 4 of the major pillars of prevention. One is stay home, which I'm enjoying tremendously. Second is washing hands on a regular basis, keeping a 6-foot distance amongst each other, and cover nose and mouth. So let's go on to the, let's try to, Amita wanted to know that what is the scientific science behind it. So Nivedita already has said that the mode of transmission is predominantly by respiratory through droplets and aerosols. The second one is also very important, where what we do is when this virus is deposited in many different surfaces, then we are touching that, and then we are touching back our mouth, nose, eyes, etc. And that's how we are getting infected. As usually, when the epidemic started, there is question that whether there is any other mode of transmission. Just a few days ago, CDC have stated that most probably there is fecal transmission, and that's why they have said going into the swimming pool is not a very safe thing to do. All of you are washing hands, and I'm just going to point out a couple of things. I do not think that all of us not only clean the surface of the front and back of the hands, but the waves of the fingers and under the nails. So that's very important. The anti-infective soap is not necessary. It is just the lathering of the any soap. And in fact, it has been shown that the anti-infective soap does not add anything to it. interesting thing is that if you are, let's say if you're in an airport and it's kind of a dirty, not very hygienic type of sink and stuff like that, as you know that many people put the water in the sink and clean their hands in there. That's an absolute no-no. You are putting the soap in your hand, you are washing your hands. 20 seconds, what is the magic about 20 seconds? Well, most probably if you do everything we talked about, it's going to take 20 seconds. How do you know it is 20 seconds? If you sing happy birthday to yourself, the first line, then it's going to be about 18 seconds. So you can do happy birthday 15 times a day. So the social distancing, this is a depiction of the fact that when somebody coughs or sneezes, most of the bigger particles drop within 6 feet. And that is the reason behind the 6 feet social distance. Unfortunately, the aerosol, what Nivedita talked about, it's kind of a mushroom of this, these particles. They can go up to 21 feet. Now, obviously, the load of the particles become less and less and less. So thankfully, we do not have to have a 21 feet distance to survive. Then we need to know that as we talked about this, the virus can survive on different surfaces. This slide shows you that it's kind of frightening on the metal that is like knobs, metal knobs. It can stay up to 5 days. On plastic, 2 to 3 days, stainless steel, 2 to 3 days, cardboard, 24 hours, which is good that you can leave your postal mails outside in the sun and don't touch it for that much of a time. Glass up to 5 days, ceramic up to 5 days, paper, few minutes to a few days. The interesting thing is that there is no contamination with the food and water. So that gives you the justification of washing your hands repeatedly, especially when you touch something. Then comes the problem of the viral particle. This is a pretty small particle. It's somewhere around 120 micron. And this is the demonstration of its comparison with the other things. For example, the red is a red blood cell. And here is a bacteria. And compared to that, the viral particle is very, very small. And that creates a tremendous problem because it penetrates almost everything. So when you put your handkerchief or a fabric mask, it really does not prevent you from getting it. So why you put this on? You put this on mainly to prevent the others getting things from you. That's number one. Number two, if one person has a mask on and the other does not have it, then again, certain amount of particles are being dispersed and inhaled. When both of the persons have a mask on, then the exposure is limited. But again, it does not prevent the COVID virus from getting in there, but probably reduces the dose a little bit. So the only thing which does that is N95. What does that mean? N95 means that 95% of the time it prevents a particle size of 0.3 micron to get in there. It's pretty good. It is not a very simple thing. As you can see, that it is a very snugly fit mask, which means that it is not very comfortable. And not everybody can go around with an N95 mask. There is shortage of it, and it is not practical. So we have a surgical mask. How it is different? Well, it is nothing like an N95 mask. The surgical mask is better than the cloth mask because it has few more layers and it's made up of polythene. So the penetration aspect is a little bit better. But again, don't kid yourself that that is preventing COVID virus from coming in. But again, when two people are doing that, then you are reducing the exposure some more. After saying all these things, again, as I told you, that there is a lot of things we do not know what is happening. For example, as you know, Sweden did not do a lockdown. And Sweden, the Swedish people are not dying like anything. In our own country, Los Angeles, not Los Angeles, California, has a 50 million population, and their death rate is much, much smaller. So there are many other factors which we are not understanding right now, but I hope that we understand it pretty quickly. That's all I have to say. Thank you very much for listening.
Thank you, Tabunda. Here, you already described that, what kind of mask we should use. I would like to ask Dr. Sudha Chaudhary that would you like to add anything, how to wear mask, or would you like to say something?
That's what I have been asked, and I have a mask ready. And this is
Hey, just 1 second. Again, our presentation is getting covered with the screen. What can I do?
You can minimize that. You can minimize the presentation. We can see you though.
I know, no. Our presentation is.
It's okay. I don't need presentation. I can go without that. Okay, the first thing, I practically, I do have a presentation in which it shows how to wear the mask, but I will go practically. I have a surgical mask here. So you go like this. You have to wash your hands before you pick up the mask and you put it on. And you go like this. You snugly fit around your nose and under the chin. Some people wear the mask for sure, but it's like this. That doesn't work. So that's the only one thing. And I have a slide. I don't know whether we can show it or not, but it shows how to wear. But this is the simple way. Okay.
Actually, thank you for clarifying that, because I personally saw a person who has this mask, but he was talking and putting their hand on the nose and taking it out.
You're not supposed to touch the mask. That's for sure. When you take it out, you take it out with your thing, like from here, and take it out. Don't take it out with the hand. You are not supposed to touch your mask in the front. That's the most important thing. Okay? And washing hands before and after. Okay, now my second thing is the alternative way, how you can increase the immunity.
Actually, I was coming to that point that, if you would like to add any like natural remedies, if you want to advise us to improve our immunity or prevention.
As you know, that the virus has created a lot of stress and anxiety in everybody, and that stress and anxiety lowers your immunity. And to get the immunity better, exercise helps. Yoga helps. Because of yoga, you can have an autonomic nervous system. It suppresses the cortisol. So stress level goes down.
Besides that, you do the breathing exercise, pranayam. Pranayam increases the oxygen, the free oxygen in the body, which is available to the cells. So that way your immunity gets better. So that's the exercise, and that is the one. Next is the supplements. Recently, it has been advised that vitamin D3, vitamin C, and antioxidants like amla, turmeric, ginger, oranges, taking more helps you, increases your immunity. Also by taking fish oil and probiotic and zinc. So all these things are helpful in improving your immunity. So that is recommended highly nowadays, that everybody should make sure you take all these things, add in your diet and things like that. I'll tell a little bit about the elderberry syrup. It is known from 400 BC, and Hippocrates called it medicine chest. Full of antioxidants and nutrient, used in many inflammatory conditions, including virus infection. Contraindication is pregnancy, lactating mother, children below 8, and the people who already have COVID-19 should not take it. There was a nice slide I had that lady recently, 2 days ago, from her shop, gave 200 bottles of elderberry syrup to free to the people.
To the front line.
Yeah, front line, so they can take it to prevent the infection. Next approach is Ayurvedic. And that is in India, we had it for 5,000 years. And according to them, they have some suggestion that the old people's immunity goes down because of the gut inflammation. And to improve the gut inflammation, they have suggested something, which I have it on the slide, but I can't show you, but I will read it. They say that digestive tea, boil 1 quart of water with 1 teaspoon of cumin seeds, 1 teaspoon of coriander seeds, and 1 teaspoon of grated ginger with ½ teaspoon of fresh lemon juice, 2 pinches of black pepper, and a little bit of salt. And you take hot tea for 2 to 3 times a day. That improves your immunity. That actually improves immunity by keeping your gut clean. So that's the one thing they recommend. And next thing is we all know that the virus enters through the mucus from the mouth or nose or eyes. So they have suggested that putting the coconut oil inside your nose, dipping a little bit drop inside your nose mucosa 2 times a day. Taking the 1 teaspoon of coconut oil or sesame oil, putting in your mouth and swirl it, and then take the hot water and spit it out. Don't swallow that. But that also 2-3 times, which cleans your thing. And if your larynx is affected, I mean, you can take the steam inhalation with fresh mint. Also, they say that you can mix the cinnamon, 1 teaspoon of cinnamon, 1 teaspoon of clove, and 1 teaspoon of cardamom. Mix it, and then with honey, you take 2-3 times a day, which helps your larynx and clears out your cough, or if you have it. This is mostly the thing which I have collected as an immunity. There is one more thing I haven't gone in detail, is the homeopathy. I think you guys might have read it, that Prince Charles was treated with homeopathy when he got COVID-19. And the homeopathy medicine, I don't have the details, but I can say this: arsenic alba 30C, rust tox 200C, taking both every day for 6 days. If you are thinking you are exposed or you're going to get exposed, or it's a preventive. And The next one is the belladonna 200. It's a treatment. So I have not done too much research on it, but this is what is in the recommended dose by the people who are using, especially in India and also in London. British people are using more homeopathy. Homeopathy is not very popular in America. It has not yet got that importance, but that's one also suggested. I don't know much about it though. And that's it.
Thanks a lot for your contribution and for your most simple way you told a lot of things. But before going to the next panelist, I want to say that thank you for all the questions you are asking, and our tech team is also working on that. We'll definitely try to answer those questions. Please email us. If you either you can chat, that is the most easy way. If you cannot chat, you can email us your question, or you can text or call to these numbers if you have any question. So our next question is to Dr. Shelley Bhattacharya, who is also who is also specialist for elderly people. Now, Shelley, people over 65 years are saying most vulnerable in this current situation.
Mm-hmm.
Why it is so, and what people of this age group should do to make themselves safe?
Sure. Thank you. Can you all hear me?
Yeah.
Wonderful. Thank you all. Thank you, Amitabh, for inviting me to this wonderful panel. And thank you all for attending. Please ask us any questions in the venues that Amitabh just mentioned. So yes, it is very concerning that adults over 65 do have worse outcomes in general. In fact, 1 in 5 deaths in this country are adults that are living in nursing homes. So 20% of all fatalities are adults that are living in nursing homes. I wanted to show you some numbers. I'm going to share my screen really quick here. Here we go. So this, every country varies as far as what percentage of different age populations have died, basically. So this is China's numbers, and you can see that 14.8% of their fatalities were 80 plus. And it's much higher. There's a big rise here between the 8%, the 70 plus, and the 80 plus. These are numbers that are given in the US. And you can see 8 out of 10 deaths reported in the US have been in adults 65 and older. And this gives you percentages of adults with confirmed COVID-19 reported in the United States. So they're COVID-19 positive. And you'll see there's a big range here. So adults 65 to 84, 31 to about 60% have been hospitalized, 11 to 30% admitted to the ICU, and 4 to 11% have passed away. Adults over 85, 31 to 70% have been hospitalized, 6 to 29% are admitted to the ICU, and 10 to about 30% have resulted in death. So why is this? This is concerning. You know, why is this trend happening? Globally, you could say, globally. Well, there are multiple factors. Number one is the house that Dr. Ganguly mentioned earlier, this house that we all have. The immunity does go down as we get older, naturally. Our immunity does wane with age. It's something that happens to all of us. However, the rate does worsen with those that have chronic diseases. So as we get older, our hypertension, our high blood pressure has become more prevalent in our bodies. The damage that the high blood pressure has done has been for more years. They have more diabetes, and the length of time they've had the diabetes is longer as we get older. So that raises our risk for getting infections, and it lowers our immunity. So they're finding that having these comorbidities, especially diabetes and hypertension, do raise the risk of fatality for COVID-19. Also, more older adults, meaning long-term care facilities, nursing homes have a much higher proportion of older adults. Nursing homes have a high, it's a great incubator for infectious diseases. It's a close-knit community. They're not always maintaining their 6-foot distance. They never do that on a regular basis. They're eating together, they're doing activities together, they have physical therapy together. It's a great incubation period for any virus, especially COVID-19, being that it is especially contagious. So practically speaking, we now see all of our nursing home patients through Zoom. We do not enter any nursing home now. And if you have to enter, everyone gets a temperature swab before you enter. You have to wear the full gown, the eye protection, the gloves. Only then can you enter the nursing home. Even family members cannot enter nursing homes. So it's a very different and challenging situation. But that is why we're thinking, we don't know all the answers, to be honest, but we're looking at trends. That's what we're thinking. The lower immunity, the higher length of chronic diseases, and the increased residence in nursing homes. They found those needing critical care, the median age is 60 years of age. So definitely the older you are, the higher chance you have of being critically ill.
Actually, it is interesting because, your finding of the underlying disease leads
Yeah.
to my next question, because you told that diabetes and hypertension are, quite common underlying diseases. So Raj, I want to ask you that, what do you recommend if somebody is having diabetes and what do you recommend for them? Any recommendation?
Sure. Just give me 1 second to get my slides going. And I'm almost there. Mhm. How do I go back to? All right. First, I wanted to thank Amitabh for a great job, doing an excellent job in terms of organizing this and putting this all together. We're going to talk briefly about type 2 diabetes, specifically in COVID-19. A lot of these things are reflections of what has been said before, but I think it's important to have some repetition in this important and complicated disease. So what do we know? So what happens is we have one great benefit is that we get to see a lot of the information and education from previous disease states. So we are able to look at the Chinese and Italian reports. So in many Chinese studies have shown that there was a high rate of type 2 diabetes in the patients who were diagnosed and were admitted with COVID. So individuals who had severe disease that led to hospitalizations was 16.2% in the diabetics versus the non-diabetics that were there. And the Italian group, in general, what happens is the second most common association with COVID-19 was type 2 diabetes. First was most likely hypertension. So what's the mechanism? What's the cause of this? And the cause is that high blood sugars can impair people's ability to fight infection, something that Nivedita talked about, but also the relationship with chronic diabetes and relationship with the respiratory tract. So there has been evidence of higher susceptibility to multiple different lower tract infections, and COVID being one of them. So going back, we were reading our minds here about we having a wall and our protection. So what happens is that we can protect ourselves by isolation, but also our own cells in our body. we have some problems. And again, this is a complex disease. And the only reason I'm sharing this is for the fundamental understanding that, science is going to provide the answers, and it's going to help us get to the next level of cure and benefits. So basically what happens is that individuals who have type 2 diabetes and have hypertension, they have a higher rate of these ACE2 receptors. Think of the ACE2 going back here as that door or entrance. So that entrance there's more of them to allow the viruses to come in. And unfortunately, people with diabetes, people with hypertension, and other potential genetic susceptibility have a higher risk of this. I just wanted to talk about that generally. So the American Diabetes Association is doing a great job in trying to promote better understanding. And I wanted to really focus on practical things for individuals in this audience. So one is, being prepared, having a phone list of your doctors, your healthcare team, and your pharmacy, a list of your medications. And if you are on insulin, make sure you have enough insulin just in case you don't have the ability to go to the hospital. So we tell patients that insulin is like milk. It'll get spoiled in a month. So you must make sure that you have backup supplies. Finally, that make sure you have extra supplies of the alcohol swabs and other things that are needed. And then we already talked about washing your hands, which is a very important thing, avoiding high touch surfaces like elevator buttons and other things like that, avoiding crowds and poor ventilation. And the American Diabetes Association for Diabetics is actually recommending or requesting for people to consider grocery delivery. I was a little surprised, but that was one of the recommendations. So what happens if a diabetic gets sick? So one of the very important things is drinking a lot of water, isolating yourself from your family. What to do if your blood sugars go low, and this is all diabetics, not just individuals who are under COVID. And then we do the rule of 15, which means 15 grams of carbohydrates, which can be 3 crackers or a half a cup of orange juice, and rechecking in 15 minutes. And then in terms of what to do with your high blood sugar, that's when you need the help with your doctor, because everyone's different. I tell people, everyone has different size pant sizes, everyone has different insulin resistance and insulin dosing. So it is good to talk to your primary care doctor or your specialist for that best care. And reiterating what other people have said is staying safe, staying healthy, but always staying positive. Because the fundamental thing is that we have to be positive in this whole issue. And that is all I have.
One quick question, Raj. Very quickly, that how to stay healthy if your child, spouse, or your roommate got infected with COVID-19?
It's very hard. So I've been hearing news reports. So I can talk about with your spouse, people are living in separate quarters, well, not separate quarters, but like one is living on the 3rd floor, the other one is living in the basement, not having dinner together, and honestly doing FaceTime or, Duo or WhatsApp to communicate with people is sad. But thankfully it is only 14 days, and people will can survive those 14 days of time.
Thank you for that. And actually, it is a very tough time for the family who has this.
Right. Can I add one more comment?
Please.
So you had asked as a geriatrician, I feel like I have to say this because only a few of you are 65 and older. So I want to make sure that I say this, and that is, please make sure you're still active. So don't feel like this is a way to always be in the house, always be sitting. There are lots of free ways to do the yoga that was mentioned earlier by Dr. Chaudhary, you can walk outside, maintain your 6-foot distance, be safe, but don't take this as an opportunity to just watch TV and be sitting. Really be active, get your joints moving. Don't let arthritis stop you. Take this really be active and eat well.
Thank you for Shelley and Raj both. My next question is for Dr. Raj Bitra. You are a specialist in rehab medicine, and also this COVID-19 is a highly infectious and respiratory disease. So how do you think that a pulmonary rehab would seem to be good for the patients recovered for COVID-19?
Thank you. Thank you for inviting me to speak. Thank you, Amitabh, for arranging this very informative session. So the first question, as you've already explained, is how does pulmonary rehabilitation benefit patients who are recovering from COVID-19? To really understand and answer that question, we need to understand a little bit about what we believe is to be occurring in the body when someone is infected with COVID-19. As already mentioned, we know that this is a viral pathogen. It's an RNA virus. We know that it is likely spread through respiratory droplets and aerosol transmission. And the envelope, which you can see here, likely has a lot to do with its pathogenicity, or it's how effective it is. We believe that when someone is infected, there is a tremendous immune reaction and inflammatory reaction in the host, in the person who's infected. And in medicine, we call this cytokine storming. And so when this occurs, it has a profound effect on our body. This includes tremendous amount of tissue damage, inflammation in the different tissues, inflammation in the muscles as well. We call that myositis in medicine. And eventually that inflammation, that tissue damage leads to weakening of the muscles. We call that muscular atrophy. So patients, as has already been explained earlier in this talk, present with a wide range of symptoms. Some of them have very mild symptoms, just some cough or cold-like symptoms. Some of them progress to pneumonia, respiratory illness, respiratory compromise, and respiratory failure. And in the worst case, it leads to septic shock, organ failure, and death. And that's what we want to provide. So prevent. So that is one of the big points of rehabilitation and medicine in general, is how can we stop this cascade? Because once you start to progress down this cascade, at one point, you can't return. In fact, that most people who are intubated and in the ICU, with each day and with each level of medicine, a higher level of medicine, the likelihood of regaining function really decreases. So in rehabilitation, how do you do this? How do you stop this cascade? Well, through supportive care, through medications. These are the things that my colleagues prevent. And then from our team, which is a physical medicine and rehabilitation team, we can provide something called pulmonary rehabilitation. So what are the goals of pulmonary rehabilitation? It's to improve our function and endurance. It's to strengthen the muscles. Remember, in COVID-19, our whole body is under a lot of stress and it's damaged because of that immense inflammatory response, or the cytokine storming. This includes the muscles of our respiratory system, the muscles which help us breathe, our diaphragm, and the muscles of the chest wall. So the main goal of pulmonary rehabilitation is to restore that function, to regain strength, and strengthen the other muscles as well. And so although I can't go through all of pulmonary rehabilitation in just a few minutes, these are just some of the types of things that our patients who are admitted at KU or any place else are going to go through once they're out of that critical phase and they're able to, sit up and they're able to stand. They use many different types of breathing exercises, which you can see on the left side here. Diaphragmatic breathing. There's another type of breathing called pursed lip breathing. They use a device called an incentive spirometer. And And then many different types of strengthening exercises and balance exercises as well. But to summarize, how does pulmonary rehabilitation help these patients? It helps them through increasing their endurance and strength through particular exercises and treatments. So that's the first question. Thank you for that. I think the second question is, Amitabh, if it's okay, I'll just go ahead and read that. We're all now in a shelter in place. How can both adults and children be physically active when there's a shelter in place order? This is a difficult question to answer, in part because everybody on this call and everybody who will listen to this in recorded format, your precautions and your exercise tolerance is going to be different. So therefore, the first point is that you should consult with your physician regarding what kind of precautions and guidelines you should have. If you're a young, healthy person who's in college, your guidelines may be different than if you were in your 70s or 80s and have diabetes and heart disease. That being said, I think there are some things that I can hopefully tell you today which can be helpful for you. And that is, when should you stop exercise? What are some things which are red flag signs? So obviously, if you have any kind of chest pain, palpitations, dizziness, lightheadedness, imbalance, you should stop the exercise immediately. Some of that seems obvious, but sometimes we all try to exercise and continue to work or train through discomfort. In rehabilitation, one of our principles is this scale. This is the relative perceived exertional scale. We call it a board scale. This is something I talk to and go over with all of my patients. And it's essentially what this scale tells us is, when is exercise too much? And this is a very simple rule. If you cannot speak comfortably, we call that conversational, if you're having conversational dyspnea, meaning you are short of breath just speaking to someone while you're doing your exercise routine, you must stop. You're doing too much. And so that has to do with this board scale or perceived exertional scale. We train our therapists to pay close attention to our patients when they're going through the physical therapy session. But if you're home alone and you're not sure if you're doing too much or too little, maybe you've gotten on the treadmill, remember this rule. If you can have a comfortable conversation with someone while you're on the treadmill, you're okay. If you cannot speak while you're on the treadmill, or you're having any kind of discomfort, or you're struggling to speak when you're on the treadmill, you must stop immediately. And finally, again, it's very difficult to go over a particular exercise regimen for everybody, as everybody is so different. But if I were to have to suggest one exercise, I would suggest you walk. I think walking is one of the best things you could possibly do. It's very simple. You don't need to buy anything. You don't need to do anything other than have comfortable shoes. American Heart Association recommends about at least 150 minutes of some type of exercise, preferably vigorous exercise weekly. If you can walk 20 minutes, at least 20 minutes a day, that would be very good, especially during this time. It will be not only good for your mind, it will be good for your body. If you have any discomfort, meaning you are having problems with speaking comfortably, or you're having pain, you should stop and decrease that by half. So you should then try to walk 10 minutes and see if you can tolerate that. But the main thing is, you must continue to be active, and you shouldn't stop being active, because once you stop being active, which is a big risk during this time, it's a slippery slope, and then your ability to go to walk decreases, your ability to go from sit to stand can decrease, and etc. So those are some of the typical things we look at rehabilitation. With respect to children, this is from the CDC and the American Pediatric Association. children require, and these are children who don't have any type of underlying health issues, they require at least 60 minutes of vigorous physical activity daily. Most of this should be aerobic. So if you do have children, I think it's very good to have them, be active. Hopefully you have either a front yard or a backyard where the children can be watched. But and if they can't go for 60 minutes, maybe they can go for two 30-minute sessions or 3 20-minute sessions, etc. But children at that age, from 6 to 17, these are children who don't have any underlying health issues, really do need to be active during this time. So thank you again for inviting me, and I hope these are helpful for you.
Thank you, Raj. I'm sure that our audience will be will appreciate all the information you provided and your suggestion and your recommendation. Now, I want to come back to Dr. Ganguly. Another important topic which we should cover is that immunocompromised people who are available and who is vulnerable to COVID-19. So I know that is a broad subject, but I will ask you some rapid fire question and some specific question so that you can give some specific reply. So first, so are you ready? Sure.
Yes.
So the first is, who are these immunocompromised patients?
Okay. I think that's a very good question. Everybody should understand who are these people first. So there are a whole lot of people falls in this particular category, but real immunocompromised patients, I will say cancer patients, transplant patients, patients are on high dose steroids, patients are on immunosuppressant medications. They are called really immunocompromised patients. Besides that, like already Raj and Shelly told, diabetic patient, elderly population over 65 years old, or any underlying comorbid conditions like chronic heart disease, chronic kidney disease, liver disease, and lung disease. So these population together, even obese patient, BMI more than 40, they are also immunocompromised. But the level of immunocompromisation is different, because the first set is really highly immunocompromised. Second set of people, they are also immunocompromised.
So this leads to my second question, that how high are their risk of getting COVID-19 as compared to the general population?
Okay, so basically there is no number that I can tell you how high, but we are all learning now, but definitely they are higher. But what is the difference between this normal population and immunocompromised population? They are more susceptible to infection, and if they get the infection, it also becomes severe. So that way that we know, based on some studies, that the chances of getting immunocompromised patient getting on ventilator or mortality is basically about 3.5 times higher than normal population. So if the normal population has your mortality, say, as high as 5%, so you times 3 is about 15%. Patients on active chemotherapy, some of the study shows the mortality is as high as 30 to 40%. So that's pretty bad.
Any extra precaution for the patients or family?
Okay, yes, maybe I can add a couple of probably extra points, because it was already discussed. We all discussed that main thing is social distancing, disinfection, and your, the wearing mask and all these things. I mean, those things are, and covering cough, those are bottom line for everyone. But I will suggest few of the things that we can do as a family member, that, if you have a single room, provide the single room to that patient. Single bathroom, utensils that can be washed separately, then clothing, you use the highest temperature. These are practical points. It's not really, it's everywhere. I collected these, points from reading every articles and stuff, but this is also very helpful. So take that everyone is exposed and place highest level of precaution in all level. Other thing, I think Raj already mentioned, usually this population, they are on multiple medications. So make sure you have your all medications from beforehand. Other most important thing in this population, there are warning signs. We always say that, high fever, your shortness of breath is getting worse, or you are developing acute abdominal pain, and CDC guideline says that patients are turning blue, I would not wait till the patient turns blue. Obviously not. So this population, these guidelines, really, you have to keep a low threshold, because these population, they do not have any immunity. So they would not have fever sometimes. They look perfect, but they are actually really, really sick. So this is the thing, I think family member, and if you don't have family, you are single, you are living, you should be aware of this thing, that if you don't feel good, talk to your doctor. That's advice I will give. Don't take your management on your hand.
Now, what do you think that they should do if they have any concern that they might be having COVID?
Okay. The basic thing they can do, isolate that person first, number one, and take all the precaution. Then call your doctor. The reason I've already mentioned why you have to call your doctor. And in this situation, keep the phone number, handy phone number, because the situation is such a way now, then half of the doctor's clinic have different working hours. So make sure who to call when you need. And then of course, if they let them decide whether you can be managed at home or you have to go to the hospital. Let them decide rather than you deciding. So that's advice I will give.
Now my last question, that it is actually related with your answer, that
Okay.
if they are going to the hospital, what 2 or 3 things they should expect, they should follow?
Okay. Yeah, I think that will be helpful for people, that what to expect if you know from before. Like, you call your doctor, probably they will ask you, depending on what you say. So if they think that you can be seen in clinic, you will go to the clinic. But nowadays what is happening, depending on what resources your hospital had, but usually tertiary hospital, bigger hospital, they are equipped with all resources. So you go to the clinic, but they usually go through a fast track channel so that you don't get in touch with other people. And also they activate your COVID management team. COVID management team means they know how to take care of COVID patients. They have all the protective equipments, and the patients are also placed in appropriate protective measures so that you do not, infect each other. And then you might expect that they might do the testing. What they do is the nasopharyngeal swab. That's a common thing. They will test that probably. They might draw some lab. They might do an X-ray depending on basically what you are telling them. So after evaluation, if they think that you need to be in the hospital, they will admit you in the hospital, and there is a COVID ward. There only COVID patients are there, and you wait there, and your test come positive, you will be in that ward. Your test will be negative. You will be shifted to non-COVID ward. And depending on what you have, and depending on what severity you have, your management will be that. But again, going back to the first one, main thing is supportive care, main thing is your immunity. So hospital will provide all the supportive care depending on what level, what severity of the disease you have. And I don't know how much time I have. If you want me to talk about a little bit of medication, I will be able to. If you want me to stop here, I'll stop here. That's the way the thing will go. The doctor will come, he will evaluate you, and depending on the evaluation, next test will be done. It could be CT scan, it could be further lab, it could be medication. Mild, quickly, mild, just the mild case, they will do just no medication, supportive care. If you have shortness of breath and according to their evaluation, it's a moderate to severe, they might give you hydroxychloroquine, which they are trying. They might add Zithromax. That's nothing standardized care, but those are, people are using and they think they are working. If not, they might use broader, like remdesivir. That's a new medication. They can use that. Now, other modalities of treatment is like interleukin, that storm that Raj mentioned, that cytokine storm is a supportive care. Basically, to stop the storm, they will give anti-interleukin 6 because that's the causes the storm. Then plasma exchange. If the patient is already exposed to disease, and that is also another thing, people are trying because nobody knows what to do, so they are trying different things. Plasma, and then respiration. If they stop breathing, ventilation. Ventilation fails, the last thing they do is ECMO. ECMO is, the bottom line is, they take out the blood, they oxygenate. It's like an external lung. So they oxygenate, and then oxygenated blood, they put it back. That's a simple way I can explain. and then definitely you improve or don't improve depending on that, the next management plan will be on board. That's all I can say.
Thank you. Actually, I know that there are many things to share, many information, but due to time constraint, we have to move on. But thank you for our audience for your questions, our supportive team, and they are taking note of that, and we'll get back to you definitely. Now, as our topic says that COVID-19 and the social impact, that side we want to cover. And for that, first, I would like to go to Dr. Shelly Bhattacharya. Shelly, my question is, how do you think that working and non-working parents care for their child in this current situation? You are also a mother of two little kids.
2 young kids, yes. I truly think that childcare is an essential pillar of a 2-wage earning family. If there isn't reliable, honest childcare, then that family structure can easily crumble. Because I have 2 young kids, as you said, age 4 and age 10, and it's been very challenging, to be honest, to have the schools be closed, because now I'm having to oversee the care of both kids, which I did not have before. I was able to have one go to elementary school and one go to daycare. So I think luckily our daycare has been open. We kept our 4-year-old home for 2 weeks, and now she's back to daycare. But it's very challenging. I have many colleagues that have had to stagger their work shifts with their husband in order for someone to be home to take care of their children. And that's not feasible. And you can imagine the 26 million people who are out of work right now. How are they coping with applying for new jobs, of earning money while having to take care of kids? Because daycare, A, is expensive, and B, could be closed. So I think it needs to be, it's very challenging, Amitabh, and every family has to have different situations. You also have to think of who can help you, and that also goes into social distancing, right? We're limited to who can help us, because you have to maintain a 6-foot distance, and that's difficult with childcare. So childcare has improved, I will say, as far as taking the necessary precautions for the children and for parents walking into daycare facilities. Everybody has their temperatures taken now. The kids are safe, a lot of disinfecting being done, bedding being changed and washed every single day. No parents allowed into any daycare facility. Like, you can't even walk in. You drop your child off and you turn around and go back to your car. And there's a drive-through pickup and a drive-through drop-off. That's it. So it's very challenging.
Yeah, that's correct. There is no doubt about that.
Mm-hmm.
Yep, it is a tough time.
Mm-hmm.
Next question is for Rohit, our young psychiatrist. Rohit, thanks for coming. Thanks for joining. So, any person is getting COVID-19, they are in trauma. Like, they are exhausted both physically and emotionally. How to navigate the phase from from the infection to the recovery? What would you like to say?
Thank you, Amitabh Uncle, for inviting me to participate in this talk. And I will apologize in advance for referring to the other physicians as auntie, uncle, or mashi. It's embedded in me, and so I mean it with no disrespect. But it's difficult to know how each family handles the stress and trauma of whether a personal family member has been diagnosed with COVID or someone that they know of has been diagnosed with COVID. And worse yet, if they have an unfortunate fatal outcome. How to manage that stress when, as so many have mentioned before, there's a lot of unknowns. We don't know who will have a fatal outcome. We don't know who will recover. And just the sheer fact that there may be exposure to the virus can create a lot of angst. So, recovering from some traumatic event like a viral infection or a pandemic where society has such a drastic shift in how they function and how they go about handling their daily activities, a lot of it comes down to trying to recreate some level of structure within your home. The American Association of Child Psychiatry released a number of articles that discuss, especially with a number of the viewers today who are parents, who now have children that are at home, who are not in school, who are looking forward to summer vacation to be with friends, but they cannot do so now. It creates a lot of stress for the children. It creates a lot of stress, which we've seen on our inpatient psychiatric unit, of a lot more children coming in because they are depressed, they're anxious, they're having suicidal thoughts, and a lot of the structure and a lot of the support that they had with school is no longer there. So creating that structure again at home, as Shelly-Auntie mentioned, is important, whether that is taking time for going on walks together, making sure children wake up at the same time every day, they carry through school at the same routine as they normally did. Trying to recreate a way of how can I have that structure and function that school provided at home as well. But with that too, I think a difficult and troublesome aspect is that parents too have to remember that they themselves are human and they themselves have emotions that they go through. So carrying that emotional burden of your child being depressed or anxious will sometimes cause parents to then negate their own emotional needs. And I think it's important that they too remember that there needs to be time for the parent to be an individual, because day in and day out now, parents are expected to play the role of caretaker at home. They're expected to play the role of teacher, of para if their child has special needs. They don't have the respite or they don't have the break that they may have received with going to work, where they were able to shift their role as a parent to a worker and carry on in a different sort of section in life. So while our focus is on our children, our focus is on making sure our children have support, parents also need to support themselves. And they need to remember that if they are not mentally healthy themselves, if they are noticing that they are more anxious, they're more depressed, but they're shifting that focus to their kids, if you are sick, caring for someone else that's sick becomes that much more difficult. And we all have breaking points. We all have points at which we can no longer survive, because stress is very real and stress affects us in so many different ways. Keys to watch out for, just really quick, on when to recognize that maybe there is a need for help beyond just physical symptoms. If you're noticing that yourself, your spouse, your child, they're isolating more, they're more withdrawn from family, they're more irritable. Throughout the day, they seem as though they're very sluggish, they're tired, they sleep a lot more, they're not eating, they're just overall seem like there is this gloominess to them. That's a sign that there might be more components of depression, that there's more anxiety. If there are these behavioral changes that you know or you recognize, you need to reach out and ask, how are you doing? Sometimes something as simple as asking, what are you going through today? What was your stress like today? Supporting each other as much as we are trying to isolate from each other is just as important, because without that social contact, we as humans rely on socialization and structure to function every day. Now that that's taken away, we need to find new ways to create that within our own families, within our own boundaries. So, the keys to recovering from this, I think, are, number one, maintaining structure. Number two, maintaining your own mental health, taking time for yourself, taking time for your family, to create some independence, to create some times where you can separate yourself. And then number three, just making sure that though we're separated, we still come together as a community and we reach out and make sure that each other is doing okay. And knowing that it's okay if you are depressed, it's okay that you are anxious. It is similar to having hypertension. It's similar to having diabetes. They are physically effective diseases. These are diseases that, while they seem mental, have very real effects on physical health, in addition to everything else that we deal with.
Thank you for all this information. But I want to share one slide, Rohit. She is a college senior student, but I want to first show you the slide, show you all the slide, her trauma, her upset. She is upset basically. So
Hi, my name is Orunima Chakraborty, or Tia, as many of you know me. I'm a graduating senior at Georgetown University, and as you can imagine, having a pandemic in your last few months of college is not what any of us wanted. It's put us in a completely new position as graduating seniors, most likely graduating into a recession. A lot of my friends and me were worried about jobs that either we have and are worried about losing, or jobs, whether there will be job offers out there. We're dealing with not being able to say goodbye, not having been able to say goodbye to our campus and our friends properly, not having our graduation ceremony, or if they've, for my university, they've postponed it, but we don't know when, we don't know how. So all of that is just a lot to deal with. And on top of that, continuing to take classes or finishing theses like me, and trying to stay motivated has been difficult. So I think for anyone who has a student at home, especially a graduating student, we just need a little bit of extra patience and TLC right now.
So any advice for these college or high school seniors who might not celebrate the way they thought their graduation?
Sure. I think a lot of that, and that was a very good video, and I appreciate Tia for being so forthcoming and allowing herself to be vulnerable, with how she's feeling. The unknown is the biggest cause of anxiety, whether it's related to COVID or life in general. And anxiety and stress and our mental health, our emotions and the way we function, our first reflexive action is to catastrophize and to go to the worst possible case scenario. It's easy to forget that this is something that will pass. This is an immediate issue, but it is not an everlasting issue. We don't necessarily know when this will end. We don't necessarily know what a month will look like, but we do know that we have technology, we have resources, we have understandings of this will pass, and we will find some new level of normalcy. So we have to then shift, what is that keyword normalcy? What does that mean for us now? That means we have to isolate, and that's okay. We're all going through this together. We need to validate each other and understand and know that we are all going through this together. And so we may not be able to go through graduation in a traditional sense, but we can still have graduation. We can still appreciate the accomplishments that we've made or that students have made through school. We can still appreciate that there is technology like Zoom, like FaceTime, different ways that we can still interact socially and see each other while we may not be able to physically do so. And just keeping in mind that, again, with where we're at now, since we are going through this together, we're all in the same boat of, we know that the economy, we know that jobs will take time to recover, and no one individual will necessarily be pushed down or pushed away because they are suffering from COVID. It will take time, but it's something that we have to keep focused on, and we have to remind ourselves that while today does not have the brightest outcome, maybe tomorrow doesn't have the brightest outcome, where have we come so far? What if Tia has done a lot in her life in terms of her accomplishments? Remembering those accomplishments and knowing that those will speak for themselves as this time moves forward. And that while right now she may not be able to see and hug her friends, she will be able to do that eventually. And we can still recreate that again through different resources like Zoom and through different resources like FaceTime and other ways. So remembering that, we are all together. We're all here to support each other. And as Tia did, reaching out and letting others know, this is how I feel today. This is the stress that I'm going through, and not isolating and not keeping that inside of us, because the more we do, the more we neglect our emotions, the more we try and hide our emotions. And to be completely frank, within our community especially, something like mental health is not oftentimes talked about till there is a very serious issue that comes about. And I think that is in the same way as other people have mentioned, neglecting your treatment if you're infected with COVID is till you're to the point where you're turning blue is not an advisable idea. The same way, if you're neglecting the fact that you notice you're depressed or that you're anxious till the point where you feel like there is no hope or there is no positive outcome, you're doing yourself a disservice. So you support yourself by reaching out and getting help, and in that way you support other people around you too. And I think that's where the importance of community and the importance of coming together, making sure that we all know we're supported and that it's okay and that we are all going through this together is very important.
Excellent, Rohit. I'm sure that this will help and many of the parents, they can share with their child. And thank you for your time, help, and support. My next question for Dr. Devika Maulik. Devika, and everyone will be agree that that all the pregnant women, all the breastfeeder, they are in the risk zone. So, would you like to say something about them, that what are the risks they have, and to the newborn baby during this pandemic situation?
Well, it's a huge question because we're talking about families, we're talking about newborns. Just going back to what you said before, it was really profound hearing a student's perspective. And the only thing that I'm going to add, and this is something that we have been experiencing and how we take care of mothers, is that as much as this is traumatic and this is harrowing, it is also a catalyst for change in a way we've never seen before. And I do want to encourage all the young people and everybody really to use this as an opportunity to innovate, to figure out ways to do things. And I know in obstetric practice, we did that very quickly, and that we had to figure out the way that I have been taught to give prenatal care. We had to just completely start from square one and figure out what is the risk of a mom coming to a hospital or to a clinic, and how much risk are we willing to take. Are you able to hear me okay?
Yeah.
Yes. So we've done that. Now with pregnancy, we, like a lot of places where a lot of people have already said, is that we don't know a lot. And we're learning as everybody else is learning. At first we thought that pregnancy might be protective. And now as there's more and more data coming out, it seems like pregnancy may actually mask symptoms, and that after moms deliver, they often decompensate. We do know now that COVID-19 does affect blood vessels, and infection does affect blood vessels. So why is that relevant to pregnancy? And that's because if you think about it, the way we nourish the baby inside is through blood vessels. And if the blood vessels are compromised, that has an impact on the health of the pregnancy. So we're finding that moms who have COVID-19 are more likely to present with high blood pressure. They're more likely to potentially have higher risk of clot. I know they just recently published, a lot of the news outlets published data showing that even healthy young people in the 30s and 40s, which is, a significant portion of the moms I take care of, even regardless of the severity of the symptoms, have a higher risk, 7-fold higher risk of developing a clot if they have COVID-19. And so if pregnancy, you already have a high risk of clot, now we're dealing with an even higher risk. We know that it can potentially also result in preterm birth as well. But this is the minority of patients. Most patients that we're seeing are being taken care of home and they seem to be okay, but we're learning every day new things about this disease. In terms of the baby being affected, again, most of the data seems to show that the baby does not get infected. There was one study that seemed to suggest there was vertical transmission. That means the baby also gets infected inside. But what they actually showed wasn't that there was a virus in the baby, but that the baby actually developed antibodies. And this was only one case. I think it was in China. But generally, that could actually be a protective thing. So it may not be a bad thing, but it sounds like most babies are not infected while in the womb. What we're worried about is that if a mom's infected, that the baby may have an increased risk afterwards through contact. And so there's a huge amount of debate because the American Academy of Pediatrics suggested that after the baby's born, that the baby should be separated from the mom. And that is creating a lot of difficulty because some people don't have resources. It's oftentimes if a mom is infected, there's probably other family members who may be also taking care of the baby who may also be infected. And so right now, I work at 5 different hospitals, and that includes like Shawnee Mission, Olathe, Truman, and the Fetal Health Center, obviously at Children's. And the general party line that most neonatologists that I'm talking to is that we're going to counsel about the risks, know that there have been actually quite a few infant mortalities associated with COVID, though not very many in the United States, and then basically sort of have a conversation, no directive, but have a conversation with parents about this. But it is a really difficult and it's a really stressful time for a lot of families. The other thing that we don't know yet is the long-term consequences. So we don't know what the long-term consequences to babies that are infected. We don't know the long-term consequences to moms who are infected, or what happens to fetuses if their moms were infected. So these are things that we're going to find out as time goes on. So
any advice you want to share for people who are coming out from this quarantine?
Oh man, so that's a loaded question. You know, I actually have two friends who had the disease. One was in New Jersey. It was actually one of my best friends. Her husband had it, and then I have another friend who's currently suffering from it right now. She had high fever for 2 weeks, living alone in New York City. And my friend, her husband fortunately had my friend, so he was able to have support. The thing that I will say is, first of all, make sure you have support. The second thing is that understand that we don't know a lot about this disease, and so it's best to keep on having a communication with your doctors. I know that a lot of people have this trepidation about engaging with, you know, their doctor or anybody, you know, associated with a healthcare facility, because they think that means an appointment and that could put you at risk again. And what I would say is that there's a lot of organs that are affected by this disease. You know, I think there was a study done in Wuhan that found that 1 in 5 people who are hospitalized actually had cardiac symptoms, and we don't know if these things are long-term. So what I would say is that go to your doctor, continue to be vigilant about symptoms, understand that because you've had it does not mean that you're immune. Also understand that there's some thought that it could be reactivated too. And so there's a possibility all these people who have been infected between last year and this year, that maybe a few years down the line, there will be some sort of reactivation and we won't know what to do. So it's really important that we just continue to take care of our health and have a conversation, get your heart checked up, get your lungs checked up, you know, do rehabilitation, and just understand that we are working as a community, patients, doctors, everybody, to understand this disease, and paying attention to your symptoms is a big part of that.
Actually, thank you, and I apologize that I asked you a lot of questions, but I also know that, you know, it is not possible for anybody to answer.
To do breastfeeding and pregnancy.
Yeah, and thank you that, you know, you tried your level best. But
right.
You know, here I would like to say to our audience that, you know, we are getting a lot of questions. Thank you for your help. Please you know, do that, and there are a few ways to reach us. You can email us, you can call, text these numbers, and or you can post your question in the Zoom chat. So thank you, Devika, for your time, help, and support. My next question, I'm coming back to Dr. Ganguly, because we have covered many things, but what about the children who are even not going to school, or maybe elementary school, or they don't know actually what to do. Suddenly they are saying that, you know, their parents are at home, they cannot play with their parents because they are busy with the work. So would you like to say something about those children? Because I know that you are also involved in your We Amra in the children project. So I'm sure that you can throw some light.
Okay. Yeah, I think, you know, children, I will consider them as a completely separate population, really. Like they are with this COVID-19 pandemic, they are also under a lot of stress. But the role of children, you know, they are very different from adults. Actually, I will say their stress level is kind of influenced by their family stress level or parental stress. If the parents are fearful, anxious, they all the time talk about death and what to do, all this uncertainty in front of the little children, automatically they will be depressed, they will be fearful too. And if you ask me what is the real social impact, I will rather divide those children in 3 categories. One, The children belong to a family who has all the privileges. Like, in this pandemic, nothing is changed in their life, really. If the parents are stable and positive minded, they can be really productive. They have everything. They have food on their plate. They have good shelter. They have all the entertainments. They have all the amenities for virtual learning, everything. Only thing what they cannot do is just playing outside, probably. And I wonder how many children used to play outside. All the time they are with the electronics, computer game, all these things. So I don't really know. But for those children, I will say that use this time. Really, it's adults' responsibility what is going to happen. No children stop growing. Whatever happens outside, inside does not matter. They will grow. Every single day is important for them. And children with all facilities, they should be more productive, be positive, stay calm, stay cautious, but use the time. How many parents used to spend time with their children before? Now we are getting some opportunity where they can have a good family time. They could have a good family dinner, keep on learning, use this time. They can use this protected time as personal enrichment. And I do not think that social distancing is a misnomer, because what they are talking is the physical distancing. I think that people are more socially active now on different media as compared to before. So, you have social media. So people should be more effective. Like the children these family children, parents should guide them, be positive, be productive. But other children, the other two category, the children which did not have any privilege from the beginning, their life was like that from before. They did not have food from the beginning. They were completely dependent on school meals. So these children are completely different. The problem, I think, is the middle category. They had good life and now they lost everything. Parents, they lost job. Parents are anxious. Children used to have good food. Now the parents are standing in the food line. So how the parents will feel? It is not just medical challenge. It is an economic challenge. It is an educational challenge. And then it leads to a social challenge. So what will happen to those children? So for those children, I will say, hang in there and ask for help. The children with all the facilities and privileges, give a hand to them. Call your friends, how they are doing. Give support, not mental support. A family who can make 4 sandwiches, that family can make 6 sandwiches, I'm sure. In this situation, give those 2 sandwiches. Sandwiches is an example, but give something to those family, do something at individual level, or get in touch with some organizations. There are a lot of organizations, they are working on the children. Like I have Uyamra, it's a very small organization, but I have a Uyamra feed. I have a little small thing. If I can contribute something, I am connected with some people. Every week I give some, I'm not going out either. I give them the money. She buys the food and she give it to the organization so that it can be distributed properly. So I will say those children, think about that. Your children have everything. Tell them that you are much better off. You are privileged. They should understand. This is a learning process. Children should understand life is not based on bed of roses. Things can happen. You have everything. Be positive. Do effective stuff. Help the other children who are needy. I see that's all I'm going to say. And the bottom line of everything, take care of yourself mentally and physically. And be positive. Whatever is going on, it will take, people are working. And other thing I want to mention on the social media, the person who is not medical knowledge, the person should not share any medical information without understanding, without knowing the importance. It is only confusing people, nothing else. There are educated people. Let them do their job and you do your job. That's all I am going to say in terms of social aspect on children. That's all I have to say.
Yeah, thank you, Dr. Ganguly. I think empathy, support, and positive attitude are needed at this moment. Okay, let's let's go to some different platform. Let's see how our teachers, our college professors are facing problem. But before going to the next section, I would like to share a screen. She is a college sophomore and she wants to say something.
Hi, my name is Richard Roy. I'm a college sophomore, soon to be a junior. Since college got closed, I have moved back into my parents' home. And some of the challenges I faced is definitely online education. I've also struggled a bit financially since moving off campus or moving back into my parents' home. I still have to pay for my off-campus housing apartment for the next 4 months, even though I'm not living there. And with extracurriculars, I'm no longer able to volunteer or work at my research lab. And I also had some plans for this summer regarding a research internship, but those plans also fell through. So I'm now having to take online classes the spring and summer semester so I can graduate in time. And online education has definitely been a little bit of a struggle for me because I realized that I definitely need that social interaction to do well in the classes. A lot of our classes require us to work with other students in order to learn new material, because a lot of the content is not covered in lectures, but rather is learned when working with other people and other students in the classes. So since we don't have in-person lectures anymore and we're not able to meet with our friends and peers, it's been a struggle for me to learn new material and also help others learn the material. But I do believe that with this new curriculum in the spring and summer semester, hopefully things will change and hopefully classes will be more online friendly. Thank you.
So my next question is for Himatri and Ruma. So everything has changed, man. You are taking all the classes physically now. Things have changed suddenly. How you cope up all these things? How you manage to adapt?
Pretty hard. Thank you, Amit, for organizing this. This was so far great. A lot of information, particularly from our doctor panelists. They are the frontline soldiers here. Period. End of story. It's us, yeah, and it's, well, we are also fighting in our own little domain, and that fight has not been so far very interesting. It was tough, particularly because the semester was halfway done, all the way up to the spring semester in person. Then all of a sudden there is pandemic phase, and we have to teach all the classes, which has never been done and never been designed for online. We are now doing online. So that change was so drastic that it put us, the other side of the table, the educators, also in a big, deep soup. How did we deal with it? Now, the puzzle that we had to solve right at the beginning was make a decision whether we want to teach synchronously or asynchronously. Now, the meaning of that is that synchronously is exactly follow the same lecture schedule that they had in the in-person situation. And asynchronously is that you create your little video lectures and leave it online, whatever your school has to communicate with the students, and then let them find their time to figure out when they will run it, teach it, do the assignments, follow-ups, and so on. It was a hard decision to make because we were perfectly aware of the fact that now students are coming back to the question which has just been asked, that students are essentially kicked out of the campus. They may not have the place where they can actually appear in a synchronous class in time, in proper exhibition mode to show themselves in the video and so on. And if they don't come there, then they are missing that lesson. It was really a hard decision. And the conventional wisdom is that go asynchronous. I thought, or we thought that it is understandable that some students might have trouble. But if we are ready to include their problems, like if a student cannot come in a synchronous class, if we can deal with them separately and give them the lesson separately, we can include them in a different way. And if 90% of the students are able to show up during the time we are teaching, then that's probably is the best way to do it, for simple reason that since they're in the groove for the first half of the in-person seminar, they do not want to get kicked out, okay? So they have a schedule, they have a time, they have a track, so they stay on track if we go synchronous, and they do their assignments and stuff, and then they also live their non-academic life fairly unperturbed. And so that was the main thing that we wanted to do, that we went synchronous with a lot of curious trepidation. Now, Ruma will tell you that how our students actually dealt with it. So I'm not going there. So that was the decision we made first. Now, the second thing, which is now, once you make the decision, that some of the classes which are essentially hands-on, for example, a physics lab, for example, in any day, even in front of a gunpoint, I own tech that a science lab can ever be done online, period, end of story. But we had to do it, right? So, so we sat down, we took each of the labs, we actually did those labs ourselves. We took the videos, we took the still shots, and then coupled them together to create an experience for the students, which is like doing their eyes and ears, but having the sense of touching by hand. And that was a challenge, a real huge challenge, particularly for us who never had any online experience working with this kind of situation before. There are many of our colleagues who had online teaching experience we never had. So for each of those labs, we essentially spend a day, if not more, to create that package that we can give to the students so that by their ears and eyes, they can have the sense of touch. It was not perfect, but I think we made some success there. But it was harder. Next time, if I ever have to teach, I will do a far better job. But then that's also, there is a very salient point there. The fact that most likely this pandemic situation will be out, our researchers, there are so many smart people doing hard work and they will find a vaccine, maybe in the fall, if not in the spring next year. And if they do that, then this pandemic situation is gone, I'm go back to my dreamland, that's in the classroom. And I do not have to do the same thing what I'm doing now. So that was creating a lack of motivation in me because I'm working on something right now, which is not recyclable. I don't want to do that. I want to go back to the classroom. I want to go back to the laboratory and teach them. So that factor always, we had to struggle with that factor of motivation, that why we have to work so hard for something we are not going to use most likely next year. Anyways, we had to still do it. So we did that. So that was the second point. And the third point I want to make is how personally I like to teach online. I hated it. For the reasons, number one is I lost the sense of, or the eye contact with my students. When I'm in the classroom, I can look at the student's face and I can figure out whether it's glimmering or frustrated so that I can, on the fly, change my expression to communicate a harder point, which I was unable to do because not all the students in a 40 students class was able to keep their videos on, which will completely devour the bandwidth and whole thing might break. So, and they're also not ready to expose themselves all the time, even there in the classroom, in the Zoom classroom. So I was always struggling with how much I should say when I'm conveying a hard and tough and challenging physics concept. And so I ended up speaking too much, always, giving up to the benefit of doubt to the students that they are probably not understanding me. They're not getting this point. So I ended up speaking 30 to 40% more than what I would do in a normal classroom. So it was highly demoralizing for me. I never enjoyed it. And lastly, coming back to the student's perspective a little bit, classroom teaching is okay, but what about the research stuff? I mean, we have our own research group, which is National Science Foundation sponsored programs, and there are a bunch of research students, and there are a couple of postdocs, and for them, running the research education, I would like to call them, it sounds a little, doesn't mingle, but essentially research is a part of education. That did not suffer as much as I thought it did, simply because of the technology. One of the things I told the other day to one of my friends is that we human beings are still very primitive. We are modern, we probably keep a face of modernity, sophistication, but innately, we are still very primitive, very basic. Our instinct is still very basic. Many of our institutes are medieval, okay? I am a non-believer, but if anyone wants me to believe in God on gunpoint, that would be our technology. Our technology is enormously, it has enormous possibility, which you would not have known if we are not thrown into this pandemic time. And so that helped us to carry on our research part, because there I do not have to really do a classroom teaching. I can just have a Zoom discussion or I mean, we used to do Skype before, but I now figured out Zoom is so smarter than Skype. I'm going to continue on Zoom from now on. So we have created our network, including a lot of our international collaborations and so on. It is no equivalent of having personal F2F, face-to-face conversation, but we are broader, we are wider. We have many ideas that we have collected. We are reaping the seeds that you can harvest later. So we are using this technology to continue our research, and many of our science societies conferences, which are completely in-person canceled, they're moving online. And great advantage of that is that, again, technology. We can now participate in many great conferences which otherwise would have been difficult to go because of travel cost, registration, hotel. But now we can go because everything is online, it's free. You just have to have some software on your computer. So that way we are fairly fortunate that we could figure out enormous potential of this technology that can, in future, when you are off pandemic, it can help us to go ahead. So that's really, really a brighter side that I discovered with my enormous delight. So yeah, that's all I wanted to say.
I actually fully understand your agony, Himadri, and I hope your like online class will stop and actual in-person class will start from fall. I hope so. I pray to the God.
Well, in fall it may not happen. My sense is that it all will depend upon how July and August is going to play out. And my sense is that it will be hybrid in the fall. It will be some kind of a hybrid mode where we have to minimize our proximity and contact in whatever way we can. So that's my sense. But next year, I really want to go back to the classroom. Sure.
Thank you. And we also wish so. Roma, one question for you, that how your students are adapting these changes. I know that you are also adapting, but how is your student?
Well, for the teachers, the problem is they are kind of older than the students. So students are the new generation. So they are very consistent with the new techniques. So they already for them it's very easy to handle all those new techniques. We have to learn. So what I would like to add with what Himadri said about taking the synchronous class. So we started taking the class at the same time as we had before this pandemic situation. So we started with that because we wanted to have some kind of normalcy in that special abnormal situation. So that's why we started to do it in the same
time because our class, my class starts at 8 a.m. in the morning. So I hated it. I don't like 8 a.m. class. Okay, but anyway, I was thrown into that. So, and my students also, they don't like to come at 8 a.m. class, but they are taking it. And if I look at the participants in my Zoom meeting, it's 100% participant. Can you believe it? And if there is someone which is who is not able to attend or so, maybe there is some computer glitch and things like that. So they sometimes email. So this is the thing, it's not happening. So we accommodate. But that is the only reason why we wanted to go synchronously, because just to keep things in the normal state, and they are liking it. Because I did not change anything, not a single thing in my syllabus. We started with, in every class, we start with one quiz points, okay? Except that 1 week we started to, just change everything from the regular class to online. So we had that, our class is basically, the format is like that. We have 10 minutes quiz time, then the lecture, then the lab they do, and then there is that lab end quiz. They have to answer all those questions so that everybody is doing great. Okay, so what I would like to say, and they are taking classes from their, maybe from their bed. Okay, so they don't have to get up from their bed. So they're happy with that. They are taking classes from, maybe they have to take care of the children, and they're doing it. So far, we did not have any problem. At the beginning, we thought, okay, it might be a problem, so we can, improvise if it doesn't work, so we can go maybe asynchronously, okay, but we didn't have to. Everything was fine. And what I would like to add, and of course, they are going to miss that, my students are going to miss the college parties, of course, that's part of life, that part of college life. That's why they want to go to the campus, to some special campus, so that they can enjoy their life. So they are missing it. I'm so sorry for that. They will be missing, I have a 20-year-old who will be graduating, and he will be missing his graduation ceremony. So I'm so sorry about that, but hopefully something will happen for them to cheer them up. And I would like to end my my points here today with 2 emails I received last week. Not last week, Thursday I had my last class. And one of my students, she emailed me at 8:05. That day I started my class a little late because I had a long discussion. And I know my Zoom meeting has 40 minutes time limit. So I started at 8:10. And the usual class time is 8 o'clock. So 8 to 8:10, I have the quiz time. So I started at 8:09, something like that. I got an email from my student. She got up 8 o'clock and she is taking all the quiz. And after that, is there any class today? Because she is thinking that I'm not going to be taking the class. Okay, so this is the first one. So she is up at 8 o'clock. So she didn't miss. And another student who emailed me after 8:30, Dr. D, I am so sorry. I am tardy today. I am tardy today. I couldn't take my quiz because of my computer problem. He apologized because he was tardy. So as you understand, my students are taking it so seriously. So I guess this is the thing. They feel this is kind of normal. So among all those things happening, they have to take their challenge for maybe losing jobs and things like that. We know a lot of students, they are working while they are taking their education and stuff like that. So it's challenging for them as well. I understand, but try to go through it. Whatever you have to do, try to go through it. Try to be normal, and to graduate this and yeah, just getting busy and be active, what Rohit says, and be active, and what Nivedita says. So those are the things are really important. So just be normal, okay? It is a situation, we will pass. We'll pass through it. So we have to. Then there is no other way out. We have to do it. So together we'll do it. That's what it is.
I'm sure the positive attitude your students are showing, that encourages you. And I'm sure as an adult, as a mature people, probably many times we need to learn something from the kids also. My next question is for Aditi. Aditi is a high school teacher, but before going to Aditi, I would like to share my screen with a video of young Megma Paul. She is a high school senior.
Hello, my name is Megma Paul and I'm a senior at Shawnee Mission East High School this year. Some of the challenges that I've faced as a result of school closures have been not being able to connect with my friends as often as I would like to, and also when I have questions regarding specific assignments or a class in general, my teachers aren't always available because their own schedules and figuring out how to run their classes. So I'll have to email them at specific points throughout the day. And clubs and other organizations like the school newspaper have been hard to coordinate via online platforms such as Zoom. However, overall, my experience with online classes has been fairly positive. I haven't run into very many issues so far, albeit there have been some issues with connecting to the internet and accessing specific documents, at which point I will have to communicate with a teacher or an administrator of some sort, and then we can resolve the issues. Thank you.
Well, Aditi, high school students are not different, right? Same like college students, and you will agree that they are also facing challenges. You are also facing challenges. Anything you want to share?
Yes, thank you, Amita, for your question. Good evening, all. So I teach math at Olathe School District, and I also teach College Now classes through Johnson County Community College. So as a teacher, I have noticed two types of challenges currently facing our educators and students: academic and social emotional challenges. Our district, like many other Kansas school districts, is following a continuous learning plan as directed by the Kansas State Department of Education. As a part of the plan, we, the teachers, are posting weekly lessons, assignments, activities, videos for students through Google Classroom and Canvas for my college students to self-learn at home. We are also holding weekly Zoom meetings to discuss the materials and answer any questions they may have. The first challenge with this setup is lack of accessibility. As Nivedita mentioned, many students, especially students of lower socioeconomic status, they do not have the necessary technology, such as a laptop or access to high-speed internet, or even proper learning environment at home. So while our district is providing paper materials to help address the issue, but still this lack of accessibility only worsens these social and academic inequalities. Another challenge with this plan, which I'm really concerned, is the lack of academic preparation for our students. Many high school students, they do not have the capacity to self-learn, and they need direct teacher instruction. And without a full year's worth of education, there will be a huge learning gap going into the next school year for all students, but especially for students who will be taking the AP tests and standardized tests. And also, as Dr. Chakraborty mentioned, think about the students in engineering, building, technical career education, biological sciences. They are missing the hands-on skills, the wet labs, experiments, which cannot be done through online learning. Now these were all the academic challenges. Beyond academic challenges, we are also concerned regarding the social and emotional wellness of our students. Students are missing day-to-day interactions with their peers, which are extremely important for their overall well-being, like lunchtime interactions with friends, interaction during extracurricular clubs like band, orchestra, debates, sports, etc., etc. This is also true for seniors who are losing their milestone moments like prom and graduation. Thus, it's become extremely important for us teachers, parents, school psychologists, counselors, administrators to stay in touch with their students about their overall well-being. Now, to help address the academic issues, We have been advising students to continue on the learning plan for the fourth quarter, to use their newfound free time to explore their passions. There are tons of resources available outside. They can take courses through Coursera, edX, and we are also providing them tons of online resources to prepare for the important academic tests like AP tests and SAT and ACT. To help take care of their mental health, I'm going to echo what Nemo said. We are offering weekly check-ins with our students over Zoom. We are encouraging actually peer interaction through social media. And we are asking students to reach out to school psychologists, counselors, as needed, and promoting healthy lifestyle choices, such as exercising, maintaining a routine, and focusing on activities that will bring them joy and happiness. I think that's all I have. So thank you all for your time.
Thank you. Actually, you brought very valid points, valid and very practical points, practical challenges you are facing and everybody else is facing. Thank you for your help and support.
Thank you.
My next question is to Dr. Usha, Dr. Usha Shah. Usha, now the schools are closed, but but country is trying to get reopened, state is trying to get reopened. Many buzz is going on, the do's and don'ts. What should we do? What should we not do? Any comment you want to put for the school reopening and how the board is preparing? You can unmute. Yeah.
One second.
Yeah, now you're fine. I can hear you.
Okay. So a lot of things we echo one another with the same aspect of online being crazy and being very difficult for the students to focus on. Directly, the school board has nothing to do now. It has to, all the schools have to deal directly with the state. The state has to provide, the state gave us guidelines. If people are interested, they can visit ksd.org on the Kansas side, and Missouri side, they can visit the DESE. So all the specifications are there for the students to work at home. It's required, say for example, a kindergarten student has to work for 30 minutes online, and middle school up to 60 minutes, and high school up to 3 hours. It's no longer easy because, as Aditi mentioned, that the students are not really trained. But given the fact that many of these districts have the liberty, can make decisions in disasters, they can close the schools up to 6 months. So there's already a contingency plan, but this came very quickly than even anybody could assume. Because many of us, all of us went into, from spring break, we are under lockdown. So there is nothing much we can do, but same thing, like students are very upset. We are offering a lot of counseling services, and a lot of other social workers are visiting homes. So hotspots are delivered home so that the student can work. So there are a lot of factors from the school perspective and the board and the district perspective that things are being taken care of. We are not going to stay like this for long, because students, all those videos we just watched, what is one of the important aspects they said? They miss the socializing, then came the education part. So we are all social animals and we need that kind of connection. And kids don't say everything to you. As parents, they don't say. Rather, they're very suffocated staying at home because they cannot really rely on you. They start growing by themselves when they become like a teenager, and they have made their own decisions on how their life should be and how their schooling should go. So it's very hard for the students to adjust to the life of home too. So as parents, you have to get up, like the regular school time, make sure that they start their work on time and provide education like real life examples at home. Small kids, read a book. Higher kids, make sure you do some kind of scientific studies at home. It's really hard, like Shelley said, people are struggling to be in between the work situation and also at home situation. But one thing is for guaranteed, because it will open by summer, and they're planning on having summer school. Maybe they will do distancing, but still the summer school will be on, and then the regular classroom will start in fall. What are we going to expect when they go in fall? Trauma, because now they are used to getting up at any time, and they have teachers, and the administrators messaging them that they didn't complete their work. And most of the schools we shut off, saying that the third quarter grade is their final grade for graduation, so they don't have to do any work. And literally all the work that is going on in the system is just enrichment. So enrichment, once you say that it's enrichment, students doesn't want to do that, but they can improve their grades. They can improve, like if they're having a B grade, come to an A grade, or they can do such kind of alteration to the grade by doing some kind of work. So echoing with everybody what they said, the doctor's view, the academic views, and the college views, everything are, but we are all in together, and then we'll come over it. So it has to do with either the state rules or the district rules or the board rules. We are all in together. That's all.
You are rightly said that we all are together, and I see a lot of positive things, and people are now probably seeing each other's face more frequently through Zoom and through other platforms. Thank you, Ushadi, for your help. I want to say, we are almost at the end, and I want to say some valid questions to a person, Mr. Kanjilal, who is representing a big business. Like, he represents a company which has almost 14,000 employees all over. So Devajita, my question is that, what is the overall impact? I know there are a lot of layoffs are going on in small businesses. What is the overall impact of COVID-19 on business like you represent?
So working in a company like Swiss Re, at least I have been fortunate to have a kind of a global view how the impact is on various kinds of businesses. So when we talk about a corporation and corporate sustainability, they stand on 3 pillars. So the first pillar is the social pillar. That means how you treat your employees, how you treat the community that you are in, whichever country you are in. The second part is the environmental pillar. And the environmental pillar is how responsible you are for the planet. The third and the most important pillar for which a company stands is the economic pillar. That means how profitable you are. So you know that all companies and all corporations are actually struggling. So when you see companies cutting corners on simple things, just understand that everybody is going through tough times. And just to give you a picture as to how big the impact is, I'll show you some numbers, and I'll look at my computer while I'm talking to you, because I'll see the numbers and talk to you. So I've just taken one factor, this social distancing and limiting of social activities, what impact it has on companies. And I've divided it into 2 groups. One, the companies that has an impact because of this social distancing, and the second which doesn't. So you take healthcare. The cost to Medicare could be anywhere between $38.5 billion to $115 billion. Commercial travel for International Air Transport Association, this could cost global air carriers from anywhere between $63 billion to $113 billion. You take entertainment industry. Film industry is going to take a hit of $5 billion. Entertainment giant like Disney, they are already saying they are down by 50%. So hospitality, major hotel companies, they have plummeted in the last few weeks. Trust on cruise lines, 0. Restaurants, sports events, you know that Olympics have been pushed out first time in the history, right? So these are the kind of disruptions that you're looking at. Retail, brick and mortar business, people are limiting going there. Restaurants, people are limiting going there. So you see struggle all around. the industry that is less reliant on social interaction, like agriculture, they are comparatively less vulnerable, but they still face challenge because of lower, ask or demand. You also see a lot of indirect impact, and this from an insurance company point of view, we can see it, like vacant assets like plants, ships, warehouse. They have an increased risk of fire, flooding, theft. All these things are happening. People are not thinking about it. So there's a huge impact on the energy sector. So whenever there's a economic slowdown, generally what happens is that you have lower energy demand. And how do the producers, embrace that impact? They reduce the productivity. But this is much bigger than that. So what's going to happen is that you have already seen oil prices going to near zero. So obviously there will be less investment, less production. There will be results of layoffs. There will be consolidations, big fishes buying small fishes or medium fishes. That there will be even bankruptcies. So why this is big, at least for US economy, just think that energy companies account for 11% of US economy. So to summarize, we are in global recession and it is massive and deep. So for European companies alone, the recession will be from -4% to -4.5%. So there will be over 200 million full-time workers that will lose their jobs in next 3 months, according to the UN Labor Agency. So the economic impact, so US has never seen an economic impact like this since World War II. So, US and Eurozone economies will take at least 3 years to come out of this, dungeon. So you will see supply chains, which is now a global phenomenon, is going to become regionalized. There will be less dependency on global producers. Just to give an example, China alone accounts for 50 to 70% of the global demand of copper, iron ore, and metallurgical things, and coal and nickel. So that's going to get impacted. Manufacturing bases may shift. The upside of it, now this was really not so good picture, right? The upside of it, because invention is the mother of invention, right? Necessity is the mother of invention. So you will see that there's an acceleration, and we heard it, acceleration of adoption of healthcare digital tools. We are using Zoom, which is an impact of that, more collaboration tools like this. You will see IoTs becoming more prevalent. So this is going to be the new norm, but let's see how things turn around and what's the impact of it overall.
One quick thing, so sooner or later country will reopen. What do you think? Any new normal for your big businesses?
Well, things like like in my case, I would travel at a drop of a hat. Not that I loved it, but that's going to get restricted. People have now learned because of this that, even without traveling, even without being face-to-face, you can be virtual face-to-face and still get the job done. So those are the kind of things that people are learning, which is the new, right? And, in our case, that there are a lot of, in insurance business, there are, especially for property business, there are a lot of risk engineers that go to properties and do an assessment of risks for a particular property or a building. Now there will be sensors that will do the assessment and give the feedback. So those are the kind of news that we see that is going to be the norm rather than an exception.
Thank you, Devajita, for sharing your experience. And on a lighter side, I like the photo behind you, and even I can even I can see myself in your photo. I'm behind you. But thank you for your all these things, and it is a fact. And I pray to God that because I also belong to the small business, so I pray to God that everything come back. we are actually end of our question session for the panelists. Now I would like to request, we have Dr. Deb Maulik. It is our privilege to have him in our community. I would like to request to him to say something. I know that you have vast experience, not confined with this country, but many countries. I'd like to just request you to say something about this current situation. Dr. Maulik?
Can you hear me now?
Yeah.
I said absolutely yes, if you have the stamina. I will give the benediction, okay?
Sure.
So first of all, congratulations. And it's an outstanding, outstanding seminar. The breadth and the depth of presentation is just incredible. You covered not only the fundamental medical, scientific background to the clinical management, to the impact on the society, on education, on young people. This is absolutely mind-blowing. This has been almost like going to be 2.5 hours, and I'll be honest with you, I mean, it did not feel that way at all. So I'm very, very appreciative of that, and I'm very grateful and very sort of impressed with what I learned today. So thanks to all the speakers, really bringing their depth and breadth of the experience and knowledge to share with us. So you asked me 2 questions. One is, what is going on worldwide? So I will bring you little personal experience because you set me up in this way based upon our conversation. So I called up 3 of my friends. One is related to, and this is actually relevant in relation to the second question. So the first one was what is going on worldwide. So I called up, I have connection with Samsung. It's a huge industrial conglomerate in South Korea. And I reached out to them. I have research relationship with Samsung. I called up a friend of mine who is a professor, is the head of the department. He's an international traveler. He is based in Perugia in Italy, another scenario. And then I had a chat with a friend of mine who is in a very prominent position. He's in Imperial College in London. And he's at the center, the storm point of the COVID crisis in London, which is the central crisis in United Kingdom. So let me share with you, that will be, I think, some light on the varying panorama of the experience that people are going through at this moment. Starting with South Korea. They never locked down. Samsung never stopped producing and doing research and development. They are slowing down a little bit because of the supply coming from China, got impeded around about March or so, and they're fully functional. And why is it like that? They did not lock down. There is going to be a recession there, but it doesn't compare with what is happening to the rest of the world. But they had a very early containment strategy, testing, some level of social distancing, tracking. Schools got closed, but private education and those institutions continued to function. And they have one of the lowest mortality in all these 3 countries I mentioned to you. So that was a very interesting conversation with them. So they are going through a very bad time, but it is probably the best of the lot, along with Taiwan and some other places. Now you fast forward to Italy. It is a disaster. They did not contain. They are doing mitigation. Everything is locked down. Economy is crashing at the rate of -8% growth. That is 8% recession. And there is still, I think the death rate has slowed down. Everything is in a standstill. And he actually shared some good things out of it. He shared with me, he's basically from Tuscany. He said, I have become a much better cook. He's by himself, his kids are away. So he has become a better cook. He's cooking for himself. And he's doing a lot of academic work. He had to do a PhD examination between 4 centers using Zoom. And he was very frustrated and stressed out with that experience. Now, I went then from there to talk to my friend in London, Christoph Lees, And his picture was really similar to what is happening in New York. Absolutely clamped down, a sense of great crisis and doom, and the government failed to take any kind of containment measures. Boris Johnson, the prime minister, shook hands, bragging on the television, shaking hands with COVID patients, almost died out of his bravado. And they are going to go through an incredible, unbelievable economic disaster, which is going to affect all strata of society, including what is happening in education, healthcare, and every other industry. So this is the way the world is reacting. Now let us come to our own experience here. It is very educational to listen to what Devjit said. It's really almost like a doom and disaster. There are three scenarios people describe. But let me tell you what is happening in healthcare industry. It is not brilliant, but I'm involved in 3 hospital systems myself. Children's Mercy Hospital, one of the most affluent hospital system, and a regional center, nationally known medical center in our community. As some of you may know, it is losing $1 million a day. $1 million a day. They had to lay off a whole bunch of people, and the top administration has taken a 30% cut. We are, believe me or not, we are a little bit better off. My main center, which is Truman, I'm involved in both the places. We have lost in our own department 30 to 40% of our revenues coming from patient care. All surgery has stopped. And the implication of that, think about not just the money. These surgeries are indicated, they are needed, but they're not life-saving at this very moment. The anxiety of these patients, torn between the risk of dying from COVID versus whatever the problem they may have that requires surgical intervention. So we're trying to address this thing, and I'm very proud of the faculty that I have in the forefront. They have risen up to the occasion. They have generated a whole bunch of, we have got task force that we formed more than a month ago. Very proud to say Devika is one of the leaders in that. She doesn't really directly work under me. There is conflict of interest. And they are really coordinating a policy that about 4 or 5 hospital systems are involved actually using that in relation to our kind of care. We hope to go around this crisis. So what the life would be in the future depends where you are. Even within the country, there are different levels of acuity of the problem. And there are different measures people have taken to address these issues. If we think that it is going to be one-time disaster, we are very mistaken. There is every possibility there will be some form of this will continue to happen. So how we prepare ourselves, not only just to get out of the current crisis, but we have to deal with any possibility of the future reappearance of this problem is not just an issue to discuss over the national television. It's a real-time, real-life issue in relation to the survival of the medical school, which is a state school, survival of the hospital systems, and survival of private practices. It is a very pervasive problem in healthcare industry in this country. And it is happening just not in here, but most of the countries in the world where they have failed to take a containment measures early enough. Good things coming out of it. I heard this many times today. I think we are probably a little bit more compassionate. We have this example of a farmer from somewhere in Kansas sent out of 5 N95 masks. The wife is very sick. 1 mask this guy sent off to Governor Cuomo. He almost had tears in his eyes on the national television. So look at this incredible example of self-sacrifice. I'm seeing this in my own department. People are going there. We have COVID patients occasionally. We have normal people. We do not know they are COVID carriers or not. They're facing this every day. So I'm seeing in real life, as over from the media, the great examples of some level of altruism, taking care of others beyond self-interest and self-preservation. This is extremely, extremely enlightening. We have seen greed, we have seen violence, we have seen stupidity, we have seen, like, you know, what they call stuck, dumb, or whatever it is the term is. But this is a very ennobling experience. Facing a crisis, there is still this aspect of humanity that can rise up to this occasion and face this incredible disaster on the face and transcend beyond this point. I will end with that note. So I'm very optimistic about the future, and we will survive through this thing, but there will be prices to pay. Thank you.
Thank you, Dr. Maulik, for your real experience, not only confined to this country, but globally. And here, I think I would like to add that hats off to all doctors, all paramedical staffs, all nurses to help us in this situation. I know that many other people are also, many other professions are also helping and behind the curtain, but they are the people who are facing the hate.
Oh, it is not just the doctors, nurses, the cleaning lady, the people running the operating rooms, people running the kitchen in the hospital, the pharmacy, the social worker. And then you have got the frontline people, the police, the ambulance, the fire brigade, and this is really a whole bunch of people. And we don't have time, but I have direct contact with what is happening in New York. The hospital I used to work was a very affluent, a big hospital system, 600-bed hospital. It used to be 95% insurance carrying patients, doing very, very well. And I have got a brand new medical school there. 60 to 70% of the total bed count is full of COVID patients. That is 3 weeks ago. Heaven knows what is going on there. A friend of mine who is the chair there, his daughter, I think, is in the front line. I have a colleague here in a high position at the Truman. His daughter is working in actually ER at KU. So there are tremendous examples going on. And I think it is in a very deep experience. Pandemics change history. It has changed the fate of Roman Empire. It has changed the fate of British Empire. It has changed the fate of the Byzantine Empire. It should not be taken lightly. The 1918 pandemic, which is just over 100 years ago, killed 2% of world population. Translate that in relation to 8 billion people, how many tens of millions of people died in relation to kind of a projection. So we need to be very respectful of pandemic, and it really hurts very much. The level of the depth of misery, death we have seen, a lot of this could have been prevented if people would have taken some action in good time. Thank you.
I think the world will be known as before 2020 and after 2020.
Oh, yes.
Yeah. So at this juncture, I think our session is is done, and I'm very encouraged to see that even our panelists are taking care of many questions on the chat level. But Sairath, would you like to bring just one or two questions? I know that we are almost 1 hour behind the schedule. So is there any question would you like to bring?
I'm just going through the question at the moment. One of the first questions was brought up by Dhananjada. So that was, what organs are affected by the virus?
I'm not sure who would like to answer that, but is there any?
I wrote that question.
Any specific person to whom you want to ask this question?
I think it said top on there.
Okay. Okay, then I think we'll get back to this question. Our supportive team are writing all these questions, and we'll definitely get back to each individual. Anybody? Any other questions, Sairath?
Well, I think we can answer that question quickly. It's not a difficult question. We know that it affects the blood vessels, as was mentioned previously. We know it has cardiac complications. We're now seeing pulmonary lung complications. We're finding vaping. Those who are vaping are also having pretty significant pulmonary complications because of the damage they already have to their blood vessels from the insults that they've sustained. Do any of you panelists want to add any more to that?
Brain. Don't forget brain.
Brain.
Brain and
Can I
kidney.
add something?
Kidney.
Oh, I don't know.
Yeah, brain and
I don't know. It's not.
Go ahead, Dr. Ganguly. You're on.
Okay. So can you hear?
Yep.
Can you hear me? Okay. Basically, you know that what I mean, it is a learning process for me also. It says that, you know, some of the articles, they say that the COVID-19, the virus, they uses this ACE receptor, which is, you know, for other respiratory viruses, they are mostly confined to your respiratory epithelium. But in this particular COVID-19 new virus, it has actually receptor in many organs, not only your respiratory epithelium, they have in the pharynx, they have in the brain, they have in the heart, kidney, liver. So that is the reason probably we have seen many young, healthy individuals, they actually are on ventilators, right? So they basically bypass that the sepsis, actually the whole sepsis scenario, they bypass. And when at the process of your getting infection, there is a transient viremia. So that point, actually you have all the receptors on this different organ, so they can actually go and straight, they can, you know, activate there, and they cause liver failure, they can cause kidney failure, they can cause your neurological problem, and also this, you know, the clotting system that Devik already mentioned, the blood vessels. So that's why the microclots are everything formed, they blocks all the blood vessel, and it really accelerates your sepsis. And that's why these healthy individuals are getting affected. And also lymphocyte has the receptor. So even if you are not previously immunocompromised, they make you immunocompromised because it's affecting your CD4, it's affecting your CD8 cells. So all the immune cells are affected. So most of the patients they have seen in the hospital, they're coming with severe lymphopenia, and they're healthy young individual. So, you know, any organ can be affected in this disease if it comes to that level, that way.
Can I make one small comment? Because Dr. Ganguly says about the ACE2 receptor. The last week, Nature Medicine has a paper, incredible paper, is saying that proximal origin of SARS-CoV-2. And it showed that the Chinese scientists showed that genetic variation and biochemical variation of this, and they put in the internet, and there are 3 groups of people published this paper, one from Scripps Institute, from Sydney, and Columbia University, and also also in England. And they showed that the binding of this virus, coronavirus, with the ACE2 receptor, is that binding site is mutated, and it mutated so fast, and so fast the binding, it cannot be manipulated by any lab. It's a natural selection. And if you want that publication, I can send you. It is a natural selection by Zoonotic. It says Zoonotic. So it is an incredible paper. I think it will be referred everywhere, where they showed that binding sequence of this SARS virus. So it is an incredible paper. And if you want, please let me know. I can send this paper. And because I said that, there is a going on that Chinese lab send this, and people are here. Also, I know New York City, some of the Avik's friend, Chinese, Japanese friend, they are threatened and bullied, which is not true, you know. So in New York City, last year, 3 bullied, and this month, there are 19 bullied, people bullied to the Asian community. So we have to be careful. And if we make a joke, we have to be careful. And this paper is significant production of this. So I just let you know that this is very important observation just published last week in Nature Medicine, one of the most respected journals.
Thank you, Animas, for bringing up this valid experience and valid information you brought. I'm sure if somebody will like to have this copy, we'll get back to them. Well, it looks like we have covered everything, and whatever we planned.
Ashim wants to say something.
Please, Ashim.
Yeah, I was in Wuhan. Yeah, I was there at the laboratory 10 years ago, and they were working on that virus, and they have strains. There are strains they are doing that. I asked them, they said that is for diseases. I did not, they did not. Then we think that they tried to mutate that vaccine, virus. So I think it is natural, not a natural. It is man-made coat of the virus. So, that is the reason that it is very, 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 very difficult to do with one antibody. So you have to do with multiple antibody, and that it will take one part, the another part, because the coat of the virus is different. It is not one. So they are wrong that the one drug will do that, or anything, or on the virus. Okay. So then we have to see that what is the coat, and how it is mutated with time or steps. So this is very difficult. It is not good. It is good. It requires many days and guessing that say 1 year. I don't think it will 1 year, but because it is muted every time. So you did a vaccine, then it came another one, virus. So it is a very difficult situation here. It is not the pox or not other tetanus or anything, So it is not that easy at that time, this thing. So the China, they could not do something there. So I knew there's something that, and there I gave a lecture also. So I did not know that they were doing this thing. Yeah. So anyway, yeah.
Thank you, Ashinda, for this information. And I know that we all are thinking like that. So I apologize that due to time constraint we could not take all the questions, all the points, but we'll definitely get back to you. Now here I want to conclude in today's session. I want to thank all of you for joining today. A huge thanks to our all esteemed panelists for giving us their valuable time, sharing their expert knowledge. It will help us to think and act wisely and to navigate through this difficult situation. Please let us know, and for the audience, thank you for your help. Without your support, it would have not been possible. Please let us know how we did. Everything has a learning point, and I'm sure that if we can learn from our experience. I want to say thank you to Sangam AC committee for the support and help you have provided us, and especially I want to mention few names. Shoirat, Aparna, you did a very good job. You are an asset for our community. I want to say thanks to Aniruddha Bhaumik. He made flyers, and it is not easy to bring all 14 people, and behind the curtain he worked every time I ping up. So thank you, Aniruddha. thanks a lot for helping to Sudhirda. And also, I would like to say thank you to Sonali. She is with me because she has helped me to form this question. And lastly, but not least, Devda, we always, like it is a pleasure to have you and Shivanidhi in our community. It is good to see you, Shivanidhi, in face now. And I was going to say that, I like the photos and behind your, behind, I can see those days.
Just Devjit cannot have it. I should also have it. Just Devjit having is not fair. I also have it.
You should say that, why boys always do fun.
Amitabh. Yeah. Shati is there. I was so happy to see Shati there.
Yes.
Kotha bolo, Shona.
So good to see you all.
Thank you. I have to say something.
Yeah.
Number one is, how many times have we seen that, forget about like Bengali get together, how about an Indian get together has started on time? And this is the first time.
Never.
On time.
Yay.
Never.
Thanks to Amita for that.
Yeah. Yes. Yes.
Thanks to Amita for that.
To that. And that is, you have done a commendable job.
Tremendous. Amita, you are a good organizer, Amita.
Yeah. Yes.
Very good organizer, Amita. Very good organizer.
Yeah.
And you touched all the subject. Kono subject tomar baat jayeni. Psychiatrist theke niye. Everything was touched. Children problem.
Yes. And
like jhol chilo na, mangsher jhol chilo na.
Totti khide peye gelo.
And like I would like to echo, like everybody said, everybody did a tremendous job and covered like a wide variety of things. And this is even though it's a learning experience, but we started out with a very good note. Very strong footstep.
Yes.
Before ending, I would like to say that at one point we touched 120 audience. So it's
goodness.
Thank you for your help and good night. Have a good time. Stay safe.
Good night. Good night.
Good night.
Thank you.
Bye.
Thank you.